I'm going to give you a whirlwind overview of my experience with water damaged buildings, mold, and mycotoxins. So for this group, you know the answer to this. Can mold make you sick? Yes. Water damage conditions indoors. Certainly there are people who could be allergic to outdoor mold and the spore counts will bother them. But I'm focusing here on water damage indoor conditions. And those include much more than just molds. You have bacteria, fungal fragments, cell wall components, endotoxins, even increased dust in these environments. So I, like everyone else, use the term mold, but when we're talking about that, we're really talking about the conditions that occur indoors when you have water intrusion. You can get infections, allergies, inflammation, and there's toxicity from these exposures. Mycotoxins, in the literature, or some of them are known carcinogens. Aflatoxin, for example, is one of the most potent carcinogens in humans. There's been mycotoxins used as biologic warfare agents. So this becomes significant since this is found in water damaged indoor environments and in the humans that we test. You know all this. I list out the different sources. Food is a source of mycotoxins, and that is well established in the literature as well. But interestingly enough, inhalation is far more toxic than systemic administration of mycotoxins. They've done a couple of studies in animals, and it's between 10 and 20 times as toxic. So, while I acknowledge food exposure as a source, I'm really focusing on inhalation in this talk. So, you've got the building, you've got things that were in the building, and sources, really anything can go wrong, and it's always something you have to consider. Obviously, transdermal isn't talked about a lot, but there was a study on transdermal transmission of mycotoxins, so just by touching them, we found that can also create an exposure, so I included that as well. So, this is actually a patient of mine who sent me these pictures. She moves into a new home. She's in her late 40s. She has 2 children who are still living with her, teenagers, honor students. They move into this rental home. They notice these dark stains in the carpet, ask the natural question, why do we have dark stains? Something about the previous owner, did car work in the house or, brought motorcycles in or something. And so the landlord steam cleaned it once. Didn't take too long for it to come back and look like this again. Then after a little while, you notice the blinds are getting really rusty. Things aren't looking too good. At this point, she has developed significant cognitive symptoms, can't remember appointments, can't keep track of things. Her balance has gone way off. She's developed significant leg edema. And in a lot of ways, for any parent, even more concerning, her honor student children are now, one of them's getting Fs, headaches, laying in bed in a continuation program. The other one says he's fine, went from being an honor roll student, getting Cs, laying around, lethargic, not wanting to do anything. So at some point, it dawns on her. So she does what she can do, which is get a Home Depot mold plate. And that's when, first occurred to her that maybe something that happened with their move was making them sick. So I asked these questions. Which one of these is the typical mold patient? Someone who's been sick, just found mold in the home and is really concerned, or just feeling sick and tired or doesn't know why? I'll go through a few of these. The answer to all of them, by the way, is either one. So anxious, hypervigilant, needs to be seen right now or I'm going to die, or just tired, unmotivated, can't do anything. Can't find the office, left all their paperwork at home, arrives 30 minutes late, totally scattered, or comes in with 3 full banker's boxes of every laboratory they've ever done and arrives 30 minutes early. Or always sick, catches everything, respiratory symptoms, runny nose, cough, or wheezing, or never sick in that way, never gets a cold, never gets a flu, but very fatigued, can't think clearly, poor memory, joint pains. Either of these are our typical patients. So some of the common misperceptions that we see in the, treating community is, this is really, the physician community, and it's completely wrong. You can't be sick from mold if you're not allergic. So some people go to their local allergist, get a skin test, they're told they're not allergic, so it's not a problem. This has been studied, I think, as far back as the late 1990s, and was acknowledged in the World Health Organization report that there are clearly immune mechanisms outside of allergy making people sick. The study that kind of resonated with me was, it was actually in a workplace where the workers were sick from the damp water damage conditions, and they only found 33% of them were allergic to anything at all on standard allergy testing, and only 20% were allergic to mold. So again, that's a really common one, so I spent a little bit of time on that. The next one, you can't be sick from mold if no one else in the house is sick. Not true, and I'll talk about that more later. This one, this I hear all the time. You can't be sick if all your labs are normal and you look good. A lot of times these people look better than other people. I mean, it's really interesting. And the labs that were tested are the traditional labs, and yeah, they may be normal, but there are other inflammatory markers and things that we can see that will really, show that there's some trouble happening. You can't be sick from mold if you didn't get better after moving. You'll hear people say that. There are reasons for that. It's a lot of my talk, but two things. One, people bring all their troubles with them. They move themselves out, but they bring everything with them. That would be the most common. The next is their body, from having been exposed so long, now has nutritional depletions, glutathione depletions, other issues, maybe nasal fungal colonization. And some people can get out and self-heal, and others cannot, and they need some support with that. This one is a doctor thing too. Whenever there are symptoms in multiple organ system, it's not a real medical problem, meaning it's psychological. They actually trained us in this. It's not possible to have symptoms in all these different organ systems, and have it be medical, which is exactly the opposite of toxicity and inflammation. They're going to affect the whole body. So these are things I like to present to the doctors to help them understand. So common presentation, you're my last hope. You got to help me. They've seen many different clinicians. They've tried multiple treatments, diets. Sometimes they get temporary improvement. Certainly some things will take the edge off and they'll feel a little bit better, but things still aren't right. They're still sick. Or they've been on multiple medications for multiple symptoms, or they can't take a darn thing because they react to any medicine they try, even supplements, some people. The rule is symptoms in multiple organ systems, so 20 or 30 symptoms. Now, I'm not saying there are other people who are sick who may not have symptoms that are that common, but this is typical. The workup that they've had so far is typically normal or not definitive. There might be some abnormalities, but no one's really nailed it. Again, they look good, they don't look sick, and usually by the time I see them, they become concerned about a possible exposure, so it's somewhere on their mind. So this is the doctor thoughts that we see. A lot of docs are scared away. I don't want to be involved in litigation. Don't know anything except allergies, fungal balls. They're delusional. They're reading too much on the internet. And I hope that anyone hearing this will approach it as I wrote on the bottom. There's a reason you're sick, and I'm going to figure it out and help you. So. This is probably geared a little more to the medical folks, but I'll just describe it. This is basic medicine. There's nothing really magic about this. It's a clinical diagnosis primarily. The labs have a supportive role. So docs and patients have this misperception. They want the test to prove they're sick. It's not that simple. There are tests. I will go over them, and I'll discuss how we use them. But really, you get a history, a very detailed history, including exposure history, and you consider all the variables that could be contributing to this person's health and make a diagnosis from there. Always rule out other causes. There are illnesses that can be completely unrelated to their exposure. There are some that may be related, but still are significant and need to be addressed. Document a very detailed review of symptoms and understand the common presentation and have a really low threshold for ruling out other serious illnesses. Very extensive past medical history is important. the family history, as you would get in any medical exam, but you also, in this case, are going to include non-related family members in the same household, because you're not just looking for biologic contributors, you're looking to see how other people in the environment, or in the case of a workplace, sometimes it comes up as well. Habits, level of functioning, are they still working? Have they had to stop? Just how are they doing right now? Occupation has to do with occupational exposures. And I actually go back to high school jobs because, that everything can contribute. Did they do house painting? Were they working in a gas station? So, I'm curious what they're doing now, but I do want to get a full background on, what they have done. And hobbies, there's different hobbies that can be more problematic than others. I think the most concerning one I heard was a model train painter, spray painted inside their model trains. So they were getting a lot of exposure from that. So the exposure history, was there any known exposure to water damage conditions? If so, when, how long, what caused it? Was it just the way the home was built? Did something happen? Did we figure it out? And usually I get a story. Usually I get more of a story. It's one thing after the other, and they, and occasionally you don't get any story at all. They really don't know. And there's reasons for that as well, because there are things that can be completely hidden in a wall with no signs at all. So this is a biggie. Were personal belongings moved from the water damaged building to their new environment? Because we talked about that earlier. That can continue their exposure. Was sewage involved? That's always really bad news. You've got a lot else going on when sewage was part of the water damaged building exposure. Is there any visible mold or staining? Always evaluate for other exposures, including any kind of pesticides. Do they live in an agriculture area? Sewage, sewer gas exposures. I usually ask, do you smell anything at all? Is there any smell in the home? And then I'll get a little more specific: musty, moldy, rotten egg, sewage, chemical, gas, and that, it doesn't, there are things you might not smell, but it gives you an idea what to look after. Are they near freeways, gas stations, golf courses, any kind of toxic industrial sites, and chemical use in their home? These are the World Health Organization guidelines, 2009, and I'll just make this point again. We're not looking for any particular measurement of mold. We're not looking for one test to tell that a person's been ill. When they look at the literature on humans, what is associated with illness is exposure to water damage, damp conditions. They define it as condensation on surface or in structures, visible mold, perceived moldy odor, history of water damage, leakage, or penetration. So again, I do talk about this later, but you're not going to have one test that's going to say your building's fine. You look at all these things. They looked at air sampling specifically. They estimated that to actually get a feel of a building, you need about 27 to 36 air samples. So this is why I get really concerned when I see air samples being used, especially to reassure people that everything's fine. It doesn't work that way. Every test method is going to have limitations. Negative results do not rule out water damage, moldy conditions. I kind of use the analogy of if you're doing a biopsy of a lump and you stick a needle in 10 times and you don't get anything, and the 11th time you get cancer, you have cancer. So, if you test and you don't find, there could still well be something there. So you have to be open to that. Symptom review. I have an extremely extensive list that I put as an attachment for the docs, but in this case I didn't. So I'm just kind of highlighting the very top ones. But what I do in my practice is I go through every organ system and I have things listed out and people circle the things that apply. Then I talk about it and I get a feel for the timing and the nature of it. But here are some of the real biggies. Fatigue and malaise, cognitive dysfunction, balance problems, sleep disturbance, especially early morning awakening, upper respiratory symptoms, chest symptoms, shortness of breath, tightness, cough, sometimes new onset asthma, gut problems, urinary symptoms, decreased libido, very common, weakness, rashes, hair loss, musculoskeletal pains, or recurrent or frequent infections. Some people come with diagnoses already. ME, CFS, the chronic fatigue syndrome, fibromyalgia, depression, anxiety, non-specific rheumatologic diagnoses, chronic allergic rhinitis or sinusitis, asthma, like I mentioned, often for the first time in their life, interstitial cystitis, which is painful bladder syndrome, irritable bowel syndrome, reflux, often new onset gastroesophageal reflux, insomnia, chemical sensitivity, often new onset as well, and neuropathy. This is basic physical. The things I often see, a lot of times tired, they're really pushing to get through the visit, and sometimes they're energized with very fast speech. A lot of abnormalities on the nasal turbinates, neck, a lot of sometimes swollen lymph nodes, thyroid, got to do a very careful thyroid exam. Lungs, you can hear abnormalities there. Sometimes fast heart rate, abdominal tenderness, look for rashes, swelling of the usually feet or legs, sometimes hands, and capillary refill, which is how long it takes to reperfuse after you put pressure on an area, because a lot of times that's delayed in my patients. For neurological, you guys spend a little extra time on that because that's such a big category with this. So you do a basic neuro exam with a little special focus on balance because that is so often affected. So Romberg, where you stand with your feet together with your eyes open and closed, and you look at how they can hold their balance, that seems to be pretty sensitive for detecting balance problems. There is a neurocognitive test battery that was developed by a doc. He's really one of the heroes in our field, Dr. Kay Kilburn. He died last August at 82, but he spent most of his career studying chemical brain injury, very much including mycotoxins. I remember reading one of his books, and there were more abnormalities with mold and mycotoxins than even all the other exposures he'd studied. And he developed a pretty sensitive test that is particularly useful because he had a huge database of controls. So you have age, gender, education, level match controls for these various parameters, which are balance, reaction time. He developed his own sway balance equipment and a lot of kind of memory, cognitive function tasks. And unfortunately, this is commonly what we see in people who've been exposed. That's the bad news. The good news is they can get better. In his career, he wasn't really seeing people get better, and we talked about this, maybe they were bringing their troubles with them, but not really doing treatment, things like that. And in my experience, people get better. We can't guarantee everyone's gonna get better, but you can help a lot. So if you're gonna do it before you start nasal glutathione. I'll talk about that treatment, since some people improve really rapidly with nasal glutathione. I learned this early in my practice. Not everybody is going to do the testing. It's a separate visit and a separate fee. So I had someone who wasn't gonna do it, and then she changed her mind and she said, I need to do it. And I think she was back about a month later, and I could tell when she walked in she was a different person, in a good way. Except we never documented, how she was before you started treatment. So if you're going to do it, it's, if you want to know how you are at baseline, do it at baseline. There are some people who have specialty in neurotoxicology and can do specialized evaluations. Going to a neurologist is fine. They're probably not going to understand much of this, but they can do their normal workup, and oftentimes it's negative. There are some imaging tests. These do not need to be done routinely. Again, I'll go back to what I said. It's a clinical diagnosis, so you don't have to have any tests. So people sometimes want tests for their own sake. They want to, feel validated. Sometimes they need to document it for other reasons. So the SPECT scans have been looked at. MRI, a test called NeuroQuant that measures, different parts of the brain is, somewhat newer in terms of looking at this. Nerve conduction testing often doesn't end up getting completed, but there are a few articles in the literature where patients with neuropathy symptoms, so numbness, tingling, weakness, things like that, actually a very high percentage of them, of the exposed patients with these symptoms, did show abnormalities when they had nerve conduction tests. In practice, we don't get that very often. It's painful, but I'm just, noting that this was found when it was looked for. Okay, so this is probably, the area you guys are most focused on, and certainly, are going to be experts at collecting the testing and looking at it. I have a lot of experience on the other end of people coming to me. I have these results, can I move in here? Do I have to move out of here? And so when I talk to docs, I spend a little time going over the limitations of testing. The short spore trap tests obviously are going to be a snapshot. If you put out something for 5 minutes, it's going to be that 5 minutes. There's no way around that. And they do vary throughout the day. And they will vary whether the building materials are disturbed or not. And is the disturbed conditions, is that more typical of how people live, walking on the carpet, running around? It probably is, rather than just sitting still and nothing happening. Easy to get false negatives. These don't tend to be speciated. And Aspergillus penicillium will get lumped together. Stachybotrys also, you're not going to find this very often on an air test. And if you do, you're going to find it at low level because of where Stachy lives. It lives in soaking wet conditions. You usually get soaking wet conditions in walls or trap spaces. And I'm going to talk at the end about fungal fragments. But Stachy is not doing its damage by intact spores. It's the fragments that can get pulled through the walls with pressure differentials, and I have a slide on fragments, so I'll talk about that. But the Stachy thing is, so if you find it at all, you really have to go looking, and even if you don't find it, a lot of times you should probably be thinking about places that have, collected any moisture, and especially walls and areas that don't dry out. Direct sampling can be done with tape lift or bulk samples. It's ideal for areas of visible mold or suspected mold. If you do it that way, you usually get, again, you don't get it to species, just to genus. You can get it inexpensively without an inspector even. Obviously, be careful with the collection. There's somebody I work with who does it dirt cheap, these tape lift collections, and I've given the name to a lot of patients because they can get overwhelmed with the testing process and expenses of that. So, and ideally, haven't seen it happen, but she gave me this input. If you had somebody there, if you were working on a building, if someone could identify it immediately, if they were there with a microscope, that really would be ideal to have an idea what was going on. Culture is usually a swab, and that will go down to species, so that can be useful too. Mold plates, rarely do any professionals collect those, but patients do, and it's and I know there are docs who work with that and have found it to be useful. I don't specifically recommend it, but if I get the results, I look at them. The ERMI PCR-based testing. Great because you get down to species, uses dust. The important thing is it gives a history of the home. It doesn't necessarily tell you what's going on right now. I have found these results to be confusing and different between companies in terms of the numeric ratings, and I'm not I'm not convinced you can just, count on a number and say a home is fine. And the other way around, I think there are people who may be in places where they're thriving and healthy and things are good, and then they get a result on an ERMI and now they're panicking. And so, it's useful, it's great technology, but, back to what I said, there is no perfect test. But it does, I do like to look at it for, if it's been done for, looking at the types of mold in the home. And a lot of times people are looking to move someplace new and they want to do something, and, this is something they could do on their own. It's not terribly expensive and can give them some information. Other environmental tests, mycotoxins can be tested. Most useful in areas of high airflow or not often clean areas. Duct filters, refrigerator coils and filters. You can do bacteria and endotoxin testing. You can do VOCs, including microbial VOCs. Moisture readings are commonly done, and those are useful, but if someplace was wet and is now dry, it doesn't mean you don't have a problem. So, I've had people falsely reassured, your walls are dry, you don't have any problem. Not that simple. Evaluate other conditions, asbestos, lead. In classrooms, well, any heavily occupied building, but I've seen crazy high levels of carbon dioxide. I mean, like teachers are falling off their chairs and everybody's drowsy. And, so sometimes you have to think of that. If people are breathing in a, poorly ventilated space for very long, that can happen. Carbon monoxide on occasion, pesticides on occasion. So these are things, you can be directed to if you have a reason to look for them. This is what I wanted to emphasize. The microbial fragments present, in different studies, hundreds to thousands of times the levels of intact spores. They are submicron size, often very teeny. They have been found to contain mycotoxins, antigens, and beta-glucans, all of which can cause illness. They are not measured routinely on environmental testing, and they are by far the most dangerous because they can penetrate deeply into the body, meaning a big stacky spore is probably not going to get past the nose. But when this is broken down, it will get in easily. And a really important point is these are not blocked by an N95 mask. I learned this at one of my very early mycotoxin lectures. Any mask you can breathe in, which is any mask you can wear, you can get these in. And I had an experience with that, going through some old stuff outside with a mask and getting sick. I've had patients come to me many times. They thought they were protected with a mask, and it's not good enough to be protected. You'd need some sort of an outside air source, like a scuba tank or something. So that's a point I want to emphasize, because really that's your biggest danger. So when you're looking at patients, you got to figure out why you're doing any particular test. For some people, they have reasons to want to look for proof that they've actually had exposure. So mycotoxins, antibody tests, and cultures are things that can directly connect to the exposure. The other thing that we do is we want to rule out other conditions which may or may not have been triggered by the exposure. So thyroid or other endocrine abnormalities, immune dysfunction, autoimmune disease. The other reason for doing testing is to identify treatment needs, thyroid, nutritional, genomic issues that might affect what medications or supplements you can use. So these are really kind of basic routine labs. A lot of times they've already been done, but these are things that are worth looking for. ANA in particular is commonly elevated. That's anti-nuclear antibody. That's commonly elevated with lupus, but we see it non-specifically elevated extremely frequently, and it can improve and go back to normal when people get away and get better. It just indicates the body's attacking itself for some reason, its own nucleus. For some reason, it's been activated to do that. Urine mycotoxin testing is a very useful test. At the moment, I'm only aware of one lab that's CLIA certified to test humans. I think there are some other labs out there. That lab only tests for 3 mycotoxins, and that is ochratoxin, aflatoxin, and trichothecene mycotoxins. But the thing about a urine test like this is it's only measuring what someone can get out of their body. So if somebody does not detoxify well, they may have a body burden of mycotoxins, but they can't get it out. And I saw that early in my practice, family all in the same house. The sickest person was negative, and he had the same exposure. So now sometimes we'll pre-treat people with glutathione without any sequestering agents to find it if it's there. So that's one way to do it. Urine analysis, I do that just routinely, just to make sure nothing big's going on. And sometimes I'll also do a urine microalbumin creatinine, because that has been seen in the literature with ochratoxin exposure. Cultures. Nasal fungal cultures are, I find them useful. They can give me an idea of what I can pick up on a swab, but just in the nose. You're not getting deep in the sinus. I tried to do those deeper swabs, and felt like I was torturing people and really wasn't getting a high yield. So, I tell them if it's negative, it doesn't mean there isn't something going on. And if you're getting better on a nasal antifungal, definitely stay on it. But if it's positive, it can be useful because in my lab, at least, will actually identify down to species, my hospital lab. So I find that useful. Stool fungal culture is useful because a lot of times people's immune system and gut are off enough that, they do have yeast or, sometimes other fungal growth. And again, I can get it down to species, so that's useful. Sputum is only helpful if they're actually coughing. I would not torture somebody and induce a sputum. That's where you give them saline and you make them cough because you just don't get any yield out of that. So the people you have who are coughing up sputum, I'll collect anything I can, fungal, mycobacteria, acid pass bacilli, and of course just a bacterial culture. And on occasion you might do some skin scrapings if you found something. Endocrine, mold exposure does affect a number of endocrine functions. So, it's good to look for that. I do a pretty thorough thyroid evaluation. If the thyroid's big, I look for antibodies. Testosterone, DHEA also can often be off, cortisol and those parameters. There's a few others. I haven't found the MSH and the VIP to be particularly useful as initial workup. They're commonly off, but generally it doesn't change the treatment that much. And when you're considering doing a large amount of testing, you've got to pick and choose a little bit what you think will be most useful. ADH and osmolality testing can be interesting because especially in the really thirsty people, they just can't, drink enough and they're always peeing. We see that off a lot. It seems to be related to exposure because that is commonly abnormal. Immune system-wise, the TB and natural killer cells and the immunoglobulin panels, I get fairly often and often see abnormalities there. I mean, considering, working as a family doc and, rarely ever seeing anything there, we really do see a lot. So the immune system really does seem to be affected. I do an IgE that looks for very typical allergy responses. Is this an allergic person? Some people are and some people aren't. And it's a good thing to know. But that's non-specific. If you want to look for specific things they're allergic to, you order it for the individual things. Candida allergy testing, that's a skin test. Not done very often, but really interesting when it is. They see if you can mount an immune response to Candida compared to tetanus, assuming you've been immunized. So sometimes people can mount a very hefty immune response to tetanus, and their body is just not recognizing Candida at all for some reason. There's something that's affected that. So that can be interesting. HIV, if there's any concern and it hasn't been done, that can be useful. Antibody testing, you can get antibodies to a number of specific molds, including Stachybotrys, Chytomium, a lot of Aspergillus species, and you can get different immune parameters to that. So that can give you some information. It will indicate that they've had exposure and how their immune system is reacting. Hypersensitivity pneumonitis panels in the same category. Candida antibody, similar how the immune system is responding. There's people who've looked at neural antibodies, and then some of the celiac disease antibodies can be useful. These are ones that, especially the first two really, are the ones we commonly see elevated. And it was interesting to see the movie last night that Dr. Klinghardt has seen, at least that first parameter, the TGF-beta1, elevated with EMF exposure. So, it indicates the body is reacting to something. The SED rate and CRP, which are classic immune markers, are usually normal. If they're not, there's probably something else going on or something additional going on. Cytokines, I haven't done that routinely. I did early on, and I'm sure we're still working out the bugs, and those are your body's inflammatory markers and sort of the chemicals the body produces for inflammation. Maybe in the future it might be more specific and useful. Mold allergy testing, I talked about that earlier. The antigens are different. Most people who are sick from it are not allergic, and So again, if they want to get an allergy or they've had an allergy evaluation, that's, interesting information. But some allergists test differently too, and some test for more, and the extracts aren't standardized. So some people may actually be classically allergic, but have tested out negative. So it may not be the end of the story. So so that is, just something to, all information is good, but like I said, it might not be the whole picture. Nutritional, this I really do like to do because I often get some really useful information from this. I do support the people nutritionally in a lot of different ways, but there's often surprises. So I have a panel that I like to do, has the amino and organic acids, vitamins, red blood cell, heavy metals, so, lead, arsenic, mercury, cadmium, and then all the red blood cell good stuff, magnesium, selenium, copper, manganese. We get CoQ10 levels, oxidative stress markers, fatty acids, and overall glutathione levels. I found it to be very useful. If people can't do it because of their insurance coverage or it's going to be too expensive, you can order some of these things individually. And some of them you order separately as well. But when at all possible, I do like to get a nutritional evaluation. Genomic evaluation is useful for determining normally and abnormally functioning pathways. I'll talk about that a little more in a bit, the limitations of that. But it can indicate treatments to be avoided or minimized in some people because their pathways just aren't right. It can identify interactions that might be more prominent for an individual. But it's not really predictive, in my opinion, for general treatment response. I don't think we have all the answers there yet. Specialist, again, I refer. I don't have any trouble referring. It's not that you are necessarily expecting every specialist in the community to have the answer to, or to understand anything about exposure or not, but you're ruling out, things that may be serious and unrelated even. So that's important. Dental, a lot of people have dental problems too, and really bad teeth. Sometimes the teeth get worse during their exposure time. And if they have amalgams and they can, do it, I would recommend getting those safely removed by a biologic dentist that won't increase the exposure while they're being removed. So, that uses the precautions, the rubber dam and the active suctioning and all the things they need to do. I want to talk just for a minute about Lyme disease because I get a lot of patients with the Lyme disease diagnosis. And this is a really tricky one. I've kind of, paid attention to this for a while. The symptoms are the same. If you had somebody up here presenting on Lyme disease, and I've been to conferences, we're presenting the same patients clinically. Because as, another doctor, one of my docs said a long time ago, the body can only go wrong in so many ways, right? I mean, you're looking at it, is the body thriving or are things going wrong? So to say something is a classic this or that symptoms, I mean, yeah, there's things we're going to commonly see. So the thing about Lyme disease treatment is there are different approaches, and one of the typical approaches has been to blast people really hard with antibiotics. And I will admit that I'm probably only going to see the people that didn't work for, but when it doesn't work in a disastrous sense because now you've essentially sterilized your gut. You've killed all your good flora, sometimes for months, sometimes with a port that was put in, that can then get infected. And I don't know. I mean, maybe, if that is the answer, I guess I haven't been seeing it that way. But there are some other docs who are approaching it more from an immune system point of view, which is what makes more sense to me, that there's something about the immune system that is reacting to this Lyme bug, which I think we all know in any room there can be people who don't seem the least bit sick, or I get the spouses who are tested and they have higher titers than the sick person. So, we know it's not you have a certain antibody and therefore you'll be sick. There's clearly an immune system interaction there. So I guess I would just say use great caution if you're ever considering antibiotics. There are roles for antibiotics. There are times when that's what you need to do, but it needs to be very thoughtful. And, I think everybody knows the strong immune system component of the gut. The detoxification part of it, I don't think I knew as well before I went in this field. And specific to mold and mycotoxin, they did a study on rats and found that rats whose guts were sterilized with neomycin could not detoxify ochratoxin A. They just couldn't do it effectively at all. So that's why the Lyme thing is a little bit tricky. So yeah, I don't think it'd be really hard to get somebody better while they're on antibiotics. I guess I'll just put it that way. And sometimes it's really hard to get them better after they're off antibiotics. So, so you have to really think that one through carefully. And there's different labs, and they, rate things differently. It's just a complex thing. So diagnostic summary, clinical diagnosis, no single test, be complete, mold testing, have pros and cons. And what I think I forgot to say is the whole role to me, and I do encourage people to use inspectors, but not so much for what tests they may or may not do. It's really for their trained eye. That's what I want to see. I want to see someone who knows what to look for, where to look. That's the value, really, I think, of bringing somebody in, not just mechanically doing a test. It can be useful to do a trial away from home to see what happens with symptoms. Not perfect, and if you go, don't bring anything with you. Just go clean, and that can sometimes be diagnostic and at least temporarily therapeutic. So, that's a relatively inexpensive way to, because sometimes you're just not sure. Sometimes like that picture I showed you, that the home is a disaster. Other times you're not sure, how big a component the home environment is playing. And mold can cause allergies, infections, inflammation, and toxicity, and affect the whole body system. So do you need to move? This you probably get this all the time too. This is one of the toughest things, is to initially get a safe place to live. These people are in crisis, and they're stressed, and they're sick, and what do I do? And and let's say we all agree there's a big problem in the home. So now, do I throw away my daughter's kindergarten poem, or they're going through a really, really stressful time. And so I try and simplify it and kind of, I'd really like you away from that environment or anything in it. I wouldn't make any big decisions about what you're going to do with stuff, because this may not be the best time to make those big decisions. But don't live with any of this stuff right now. While we're trying to get you better, just don't have it in your environment. And then down the road, if you're feeling better, you can decide if you want to revisit any of these items. Truthfully, most people don't want to. They're good. If they got better, they don't want to take a chance. But some people may, and they may be able to, be around some individual thing. So, so that is a big deal. The other thing that's really big is people are particularly sensitized to the mix that got them sick. So that little stew is what they've been fighting, they've been recognizing, so sometimes even the teeniest amount of that will trigger them more than even being in a different moldy building or, a different unhealthy building. So that's why making that clean break from that first exposure is such an important thing. Now, if that continues and they're continually running over and over, then I think in certain ways you end up in a different situation of hypervigilance, and and that's not ideal either. So I'm always walking this line of, clinically we put together a mold and mycotoxin workshop for about a dozen specialists. That one was about a year and a half ago, and everybody who spoke on that initial exposure said you have to make a clean break the first time. Every clinician, PhD, you just do. And I know it stinks, and it seems really devastating. And again, these are the people who become very ill and have clearly problematic homes. I'm not saying anybody, if they had one isolated thing and we're not really clear if they're sick from it, but these are, when you're in that category, odds are that you're not going to do well if you're around any of this stuff. So a lot of times people have heightened sensitivity after exposure. Dr. Claudia Miller developed the toxicant-induced loss of tolerance model. It seems to apply to these exposures as well. Some people come into it chemically sensitive, and then it escalates. Some people, that's the first time they ever noticed it, was around their exposure. And initially, that is very heightened. With treatment and time, usually people can get to a place where they still don't want to be around these things. I mean, they know it, but it's not as intense as it is initially. And what I don't like to see is people getting stuck in that intense phase, because then they're, kind of the hyper reactors who can't be anywhere. And, their immune system is so triggered, and the hypervigilance in it really is its own problem. So again, it's always a balance. Yes, there's a lot of environments that are unhealthy that you want to avoid, but it's good to get to where you can have some tolerance. You also get a very increased sensitivity to food, gluten, of course, being the most obvious one. But, foods that never bothered you all at once, you can't tolerate. And again, hopefully that's not necessarily gluten. A lot of people are going to stay off that forever. But other foods, hopefully you can get back to, a somewhat more normal diet in time. But at that period, it can be tough. Treatment, it's individualized. General principles apply. You don't necessarily need labs for treatment, but you may need to monitor some things. Nutritional, I like to get at least a baseline blood count and chemistry panel. You see people who are paying everything cash and can't afford to do any, there's a whole range of what you can do. So at a minimum, and that's just because I want to see where they are at baseline. It's not because the treatments are dangerous. I just want to see, how they came into this. Monitoring nutritional agent, because one of the treatments we use has the potential to bind nutrients. So, and avoidance, that's huge. I mean, that's really, I tell people that's the top 1 to 100 things. Sometimes when I used to actually take my own calls, I tell them that, if you get away, you make a clean break, then you're still not doing well, come and see me. So, if they can really, so if you guys can get them in these healthy environments, and, it's huge. And they've been studying, actually, so there's someone who's done surveys. I think she's looked at about 150 people so far, and avoidance has had a huge impact on their health improving. Again, don't make permanent decisions under pressure, but avoid living there, and avoid items that have been in this home. Paper is hopeless. There is no way I know there are companies who will supposedly HEPA vacuum their books, and one of the next few slides I'll explain why that's not going to work. But being around paper, it's just not going to work. Soft materials are very vulnerable. Unfinished wood is very vulnerable. Electronics, because of the fans, are constantly pulling everything in. So in a way, they probably, that guts of that computer probably has more exposure than anything else, and it's blowing it back out. So, so that's an issue. What I'm most interested in is how an individual responds to an environment. So some people want to be tested, and they want to have their clothes tested and their couch tested, and I don't generally recommend that, because that's not likely to give me useful information, and it's extremely expensive. So, and it won't guarantee that something's safe. So this study, I do have the full article, and it's a really important one. That was 2012 in Scandinavia. They looked at they deliberately contaminated building materials with Stachybotrys and Aspergillus. And, and they generated their mycotoxins. And then they tried to treat them with everything we would normally treat with: bleach, ammonia, boric acid, ozone, UV light, hydrogen peroxide, and heating. Nothing completely destroyed the mycotoxins. The most effective two things were ammonia and boric acid. Ammonia being a little more effective, but nobody wants to be around ammonia, till it's off gas. So, but not completely. And the thing I tell people is that it is really easy to kill mold. I'm not even interested in killing mold. You need to physically remove it. So, that is, so people will try and sell them this or that product, and I go through this, and sometimes I'll go as far as talking to somebody about their new product that's going to fix everything. It's always ammonia-based, usually. And it's not going to fix everything, when I first started in the field, we used to say dead mold was as dangerous as live mold, and now I've heard people say dead mold is more dangerous than live mold, and I think that's true, because then you get the fragments and the living growing mold happened. That's there, but killing it is, That's not what we're talking about. You need to physically remove things safely with good containment. That's where I've also seen things go really wrong, is when either the person themselves or they hire somebody who just cuts open the wall, or the landlord sends their handyman, and now they've taken a really bad situation and made it horrible. And a lot of times the health declines will correlate with that, that when somebody came in. And then the other time, which is really tricky, where people's health gets worse, and this is good to know, is when they move. And I think usually they'll notice it the most, within the days or weeks after they've actually moved out. And in my experience, that has been because of what we do when we move. Almost nobody walks out with the clothes on their back and then changes and does nothing. People scramble, they're looking through things, they're disturbing everything. That's human nature. You're gonna go through. And so now they've completely increased their exposure, whether they wore a mask or not. We talked about how that isn't good enough. So, and then they land in the new place, with the stress and the physical exposure of the move, and they're a mess. And so that, if you weren't familiar with that process, you might think, oh my gosh, their new house is terrible because now they're really sick. And, a lot of times you have to ride that out for a little bit and get a feel for it. So, so that's common. This is the total load. This, I didn't see the Bill Ray on this. This was something I was able to download, but I really think of Dr. Bill Ray in Texas when I see the rain barrel. And I found this to date to be the most useful model for how people get sick and how they get better. The way I describe it is, things come in. So, you got everything listed, that from EMF exposure to, pesticides to, sometimes, and that's why it's good to get a sort of a life history of people, because sometimes you can sort of tell that rain barrel got full when they were young, if things started to fall apart, there are people who've had chronic fatigue symptoms since they were 13, 14, or, different, and it just gives me a feel. And the other reason it's helpful is it gives me a feel of how people get better. So what happens, and the point of it is that a lot of time as we're filling, as the rain barrel's filling, you don't notice anything is wrong at all. You feel fine. And then you hit overflowing. And, things, and then a lot of times you kind of skirt that edge. So you've had a period where, you're a little off, and then you get better, and then you're a little off, and, and that can be confusing too. And so that is useful for treatment, because my goal is to lighten this, both by keeping all this stuff out, obviously, as much as you can. I mean, we're still living on planet Earth. It will never be perfect. We're always going to have, some ability to detoxify, but also improving the body's ability to handle it. And then the other thing is that's why nobody gets better just linearly better. Everybody kind of gets, if you get a little better and then you crash down a bit, and then you get better and you crash down. And what we're looking for is the trend towards better. But it's good to explain this to people, because the first time they dip down, they get really bummed. Well, when they get better, they get thrilled, because, I always ask the question, how many good days a month do you have? And I get 0 a lot. There are people who can't remember their last good day. Sometimes there's people who have, are kind of in between. But so when they finally get a good day, they are so excited. And then when that kind of comes back down again, they can get really disappointed. But if you kind of explain to them and their, family and stuff what to expect, it is helpful. So now here are some of the things we do for treatment. Obviously, reduce total load. So avoid everything you can. I do emphasize combustion products, because a lot of times people don't think of that. Pesticides. I also emphasize pet flea control products. I think a lot of people don't spray pesticides, or, but a lot of times the little drops you put on your pet can be significant. VOCs and fragrances used indoor from all the traditional cleaning products, and deodorizers, vinyl chloride, heavy metals, both in terms of your environment, which hopefully you've got that under control, but also in terms of your diet. Fish, I'm not sure we have really healthy sources of fish right now. I find, because that test I do measures red blood cell mercury, and some of the worst, amalgams you'll see it, but some of the worst I'll see are especially the young, fit men who are working out a lot and we're eating a lot of tuna, and as a lean protein source, and a lot of times that can really push them over the edge. Avoid agricultural areas, golf courses, freeways, industry, especially if you're downwind. EMF exposures, you guys are way beyond me on that, but it is something I do identify and address with my patients. So, I do what I can, not to the level that you've been doing it, but I might increase now that I've learned a little bit more. But I definitely point out the contribution to their total load. And again, I've always just stated as using the precautionary principle, that we're in this huge experiment and we're getting a lot of data of concern where we're probably not going to, it'll probably be another several years till, it's totally conclusive, but there's enough information now that I recommend reducing that load as much as possible. If outside air is good, get fresh air. I mean, almost always the outside air is better than inside. We typically as humans historically spent most of our day outside and active, and now we spend most of it inside sitting on our butts. And, there's something different about it. So get some sun too, but with proper, you don't necessarily burn your face, but getting actual live sun in a safe manner does things beyond what vitamin D can do. And you do need, many people need vitamin D. They need to supplement it, but just the whole process, I think, is healthy and does more for you than just the vitamin. Air filters, I typically recommend ones with HEPA carbon zeolite. This is an area you guys probably have your own favorites. The thing I say is that there is no filter that is going to make an unhealthy environment healthy. So if you think you're just going to buy some filters and stick them in, and that is never going to work. This is to take the edge off, to decrease the particulates, because we've learned more about inflammatory effects and neuroinflammation from particulates. So it can be helpful. Don't get ones that are generating ozone, because that can be an irritant. Water filters also, ideally, where your water comes in and at your drinking water source. Again, these are, there are a lot of opinions on water filters. I know that can be its own complex topic, but I do recommend using them. Create what we call a bedroom sanctuary. You think of your bedroom as your healing place. This is where you really need to recover. So you'd want it to be, when at all possible, non-carpeted. A lot of people are renting and it's really apparently hard to find rentals that don't have carpet, which is disappointing, but it seems to be the case. So, but non-carpeted, don't bring your beds or bedding or sleepwear. People actually do that, bring their pillows and things. Do not have many dust-catching items in the room or keep them in some sort of a non-toxic cabinet, and have some ventilation there somehow, whether it's an open window or a system. But and pay attention to your mattress too. Our mattresses are, the mattresses we can buy routinely are horrible. And I've actually seen that be the trigger for people getting sick. They bought a new, I won't say a brand, just say a foam mattress that they paid a lot of money for because they have backaches or whatever. And, all the stuff this is off-gassing is really disastrous. So kind of a quick fix is there's a company that sells charcoal blanket. And if you put that over your mattress, it does do something. So again, this shouldn't be your mattress that was in your moldy house, but if you're just trying to make your mattress situation healthier, that can be useful. Glutathione, this is really kind of huge for treatment. I know you guys aren't, some of you are medical more than others, but I think you try and help your clients. So I'll just, won't spend too much time, but I'll explain why these things are helpful. I'm also going to say, this was designed for doctors, so I do have some things listed with dosages and stuff. Do not do this at home. It's not that this is a dangerous thing, but this is to be, this was designed to be for doctors to, have a guideline to treat their patients. And so because it's there doesn't mean I'm telling you to go out and do all this stuff. But glutathione is we call a tripeptide made of glycine, glutamine, and cysteine. It's the way the body detoxifies just about everything. You can support it with certain precursors, N-acetylcysteine, whey protein. Initially, N-acetylcysteine was really the way to go because cysteine seemed to be the rate-limiting step for a lot of people in forming glutathione, and we weren't able to get the glutathione in the body intact orally because your body just digests it, like it would a hamburger. It just breaks it down into its amino acids, and so it's not as useful. Now there's some formulations, some liposomal formulations that the way they create it, you absorb it intact and you can get your glutathione levels up. So I'm going to talk about those options. But deficiency causes cellular damage and mitochondrial degeneration. Mitochondrial issues are big. That's kind of that fatigue, weakness, a lot of what we see in patients. If you do a blood test, you're typically just going to get a total glutathione level. It's not going to differentiate reduced or oxidized. So it can be interesting if the total is low, that's important and that gets people's attention. But if it's not, it doesn't mean they don't need to take glutathione. So, every time I do a test, it's tricky because people, think they figured it out. And there are a few tests that are like that. I'd say vitamin D is like that. You either need it or you don't, or, that one's pretty direct. But other things are a little bit trickier in terms of the information you get. This is key for treating patients exposed to mold and mycotoxins, often depleted with exposures. There are genetic mutations that can cause the functioning of this to be worse. But that does not mean that, for example, they've found increased toxicity from aflatoxin in, one of the SNPs, GSTM null. But the things I hear from people who've done the genomic testing, which I'll also talk about, I don't make glutathione, I can't. And it's true, they're probably, the functioning is not as good as it should be, and you probably really want to be careful, or pay attention to supporting it. But it doesn't mean that other people don't need to support their glutathione after exposure. And if you're taking glutathione, you are going to want to use some form of a sequestering agent. We call them a binder. I've described them as sponges. These are things that go in the gut and keep the body from reabsorbing toxins. Your body's always wanting to reabsorb from the gut because they're trying to get nutrients, we're trying to be efficient. But if you've now taken some glutathione, you're kicking out more mycotoxins, you want to try and bind as much of that and not reabsorb it because you want to try and get ahead of the curve as much as you can. So I'll talk about that with treatment. So the most important thing to know about glutathione is that for some people, when they're first touched by glutathione, it can trigger significant detox. I describe it to people as hangover type symptoms. So, headache, muscle aches, weakness, nausea, fatigue. And from a medical point of view, we have not found these to be, when I say medical, I'm putting on my kind of family practice, classic doc hat. These are not things that, admit people to the hospital or trigger, really horrible medical conditions, but they can be upsetting. And some, people have different tolerance for going through that process. So that's where I'm saying don't do this at home. That's kind of the art of you decide how much you want to start with. I'll typically start on the low end and sometimes very low and see what happens. And other people, nothing happens and they really need a lot to kind of get anywhere. So, like I say, my crystal ball doesn't work in those settings. I don't know how much people need. So you start with what, typically is low enough to maybe, not trigger most people. But if it does, it's okay because you just skip a day or so and you stay on your sequestering agents and, you're just aware of it. And the other thing is after people go through kind of one of those, they usually come out in better shape than they went into it. So that's sort of the consolation if you do get that kind of, detox hangover-y situation when you start. There's different forms of glutathione for different purposes. The oral liposomal one, I pretty much use across the board, and unless there's a reason not to. There's one that I found to be especially effective, and it's been, I think they have about 10 published studies so far. It really does seem to work, so if people are using a different one, I'll switch to, have them give a trial of this. Best taken on an empty stomach, wait at least 20 minutes or so to get absorption, and once a day is okay, unless you're getting to really high doses, and then you might want to split it up to improve absorption. Transdermal, less systemic delivery. It is okay for children who aren't going to be very cooperative with swallowing something that's got a little bit of a sour smell and a sour taste and a stinky smell, but and there's a few adults that just like to get it that way, but you're not going to get as much bang for your buck. Glutathione's expensive, so you want to, do what's most effective. Some people use IV glutathione. I think how that works is it gets your levels up high briefly, and there, it's been used for different purposes. I haven't really found that I have to use IV glutathione, so I've been able to treat people without doing that. If they want to do it and they can afford it and they're going to someone who's doing it, it's okay. I just don't think, again, we're talking, this process is expensive, so you're just trying to keep, do what you're going to get the most out of. Nebulized glutathione, you breathe it. We've seen beneficial, or the literature has shown effects in cystic fibrosis, emphysema, pulmonary fibrosis, even ear infections, and chronic rhinitis, and it looks like HIV. This does raise the glutathione levels in the epithelial lining fluid. It's decreased some of the inflammatory cytokines that I talked about, improved the function of the lungs, the FEV1, in cystic, and actually decreased the infection to the Pseudomonas for cystic fibrosis. So I found that to be a useful way of delivering it for my patients. And for some reason, it seems to be calming for some people. I have a few people, I have someone who uses it for performance anxiety. I've had somebody with anxiety who really couldn't get out of her home, and she could, that afternoon. So I'm not sure exactly how that works, but it seems to be helpful for the lungs, and some people like how it feels. It's good to do a test dose in the office. There was one study of about 8 asthmatic patients, and they found that it increased wheezing in that patient. The literature has seems to feel that these are sulfite-sensitive asthmatics, and as far as I know, there's never been a hospitalization, a status asthmatic, anything serious happening from that. But I do like to do the first dose. I haven't seen it to be a problem. But the other reason to do a dose would be to see if people like the effect of it, because it's another investment, and how they feel with it. So. Intranasal glutathione, that's mainly for neurocognitive symptoms, so the memory balance, brain fog type symptoms. The idea is there's an area in the back of your sinuses, cribriform plate area, where you can get things in. And so when you do it, you have to lay with your head back and let it sit there for 5 or 10 minutes. And a lot of time, that's the one I told you earlier that, cleared that woman up who had a lot of cognitive and balance issues. So, you can take it as much as you need to. It doesn't seem to be problematic. Usually I ask people to do it 3 times a day, and they can do it a few more times, if they're reacting to something. They study glutathione. So far, to my knowledge, they haven't been able to kill rats with glutathione or cause any trouble with too much, but you still want to, pay attention to how you're using it. So you can bypass the blood-brain barrier. It's been helpful for rhinorrhea, so sometimes you get the added benefit on the nose. And it's been studied for chemical sensitivity, allergies, Parkinson's, Lyme, fatigue, and generally well-tolerated and effective. And most common effects, irritation, bloody nose, headaches. I haven't seen a lot of that, but the most common thing I see is usually teenagers. They don't like the smell, because it stinks, and they just can't get over the stinky smell. But most people do fine with it. So sequestering agents, they have a high surface area to volume. We talked about why where they're used. They can be taken together, not absorbed systemically, so they stay in the gut. So, and they should be separated from other medications and supplements by at least 90 minutes in either direction, because you don't want them to, bind the good stuff that you're trying to take. Charcoal seems to be the best tolerated, easy to take, comes in a capsule, cheap. It's particularly good for the trachs, and the dosage, it ranges, but the main thing is about every 12 hours is the key. You want to get at least twice a day in. So, whatever dose you get at, do break it up. And we found it to be effective when it's really the only thing used. So, a lot of times people are on cholestyramine and different things, and that's okay. And there's a place for that too. But you can use the charcoal alone. Dr. Michael Gray in Arizona figured this out because for cost reasons and tolerance, and he was finding the same improvements in symptoms, mycotoxins, and inflammatory markers with just using charcoal, which is great. Cholestyramine, bile acid resin, it's particularly effective for ochratoxin. I have a paper where I looked at a lot of these things. And so if people have ochratoxin, a lot of times we'll try and get it in. It's been used forever in the toxicology literature for a lot of things. Fat-soluble toxins, binds endotoxins. People can get gut symptoms with this, especially if they use the commercial, the regular commercial product that they'll get for a $10 copay at their pharmacy, which has sugar, artificial colors, propylene glycol, a lot of things that bother people. But, again, it's cheap. And so some people will try it. If they can do the pure powder, that is ideal, and that is better tolerated. So it does not taste good. You want to mix it with something sour or something, has a strange consistency, but it is tolerated better. Clay is particularly effective in the literature for aflatoxin. I'm always nervous because I wonder if it could be a source of heavy metal contamination in itself. So there are some patients who've researched certain ones, and I can tell you later that they feel pretty good about. I don't use clay in everyone, but some people love clay. That's their thing. So everyone's a little different, and if that's helpful to them, then that can be good too. Chlorella, also I kind of reviewed that a bit in my paper, can have some beneficial effects with mycotoxins and mercury. Does have some iron in it. I have a few hemochromatosis patients, so you don't want to use it for them. Sometimes, maybe I only saw that once, actually, to be honest with you, triggering symptoms in someone with autoimmune. I don't really see that often, but I did put it on there. The key to chlorella, though, is you need a product that was grown on filtered water, because if it was from the ocean, it will have done what it's supposed to do, but unfortunately our oceans are not clean, so it's already absorbed a bunch of junk. And when they studied this, they found that there's a doc who does a lot of research, and he found that those products were particularly contaminated. So he gave me the name of the one that he tested out clean, so that's the one I recommend, and I'm sure there's a few others. The idea is if it's grown on filtered water, then it hasn't picked up all the garbage. This always comes up to what are the nutritional effects of the sequestering agents. We don't completely know. It's reduced if it's taken away from food and supplements. I do monitor vitamin levels. The only study I could find was with clay, and they found that it was helpful for aflatoxin and without interfering with the vitamins that they looked at, which was A, E, iron, and zinc. So that made me feel a little better. But we don't have extensive literature on this. My thought is, you only use it if you need it, and a lot of times these people, their guts, dumping mycotoxins in there and irritating the gut is its own problem. So if you can protect that in a way, if you can promote healing of the gut, you'll end up better nutritionally. So it's one of those things where it's not like we're telling everybody to take these things forever. You're doing it for a purpose in someone who's had exposure and had symptoms. Or nasal antimicrobials. There's, some people just do better both with their nasal symptoms and sometimes overall when they treat with a topical nasal antifungal. There's, this hasn't been studied in great detail, but there's some thought that if you have colonization, you could have your own little mycotoxin factor. I think even more likely is that your body's having an immune response to it if it's still there. So, both of those factors might come into play. You can't get sensitivity, so we have to just treat clinically. And these are some of the things that I often start with. Again, these are topical, very dilute solutions, and if any is absorbed, the pharmacist estimated once to me that it might be 1/200th of that. So systemically, we're not talking a lot with nasal itraconazole or Ampho-B. Clean your nose. Nose is a filter. The cleaner you keep it, the better. At least twice a day. Some people do more and feel better. There's some biofilm disruptors. They have like EDTA, polysorbate. I even had a patient who put baby shampoo. His ENT told him to do it, and that smells horrible, that stuff, but he found it helpful for biofilm. So maybe, there must be something in it that But there are some solutions you get from compounding pharmacies that have some of these things. If they get an acute sinusitis, these same compounding pharmacies can add in bacterials, and they come in an atomizer. It's a nasal atomizer. It gives a nice distribution. If it doesn't, if they don't tolerate the atomizer, they can put it in a squirt bottle. Diet, try gluten-free, dairy-free, avoid any food allergens. There was a doc who did a lot of work on this, passed away about 10 years ago, but he used to put people on a mold-free diet. I bring this up because I generally don't unless they have allergies to foods. And the reason being that fermented foods seem to be very helpful in healing the gut. So if you're going to be on a mold-free diet, you can't do the sauerkrauts, kimchis, kefirs. And, I look at it historically. We got our probiotics from food, and we can get them from a pill, but we don't always know if the pill is alive. When they study the pills, some are alive and some aren't. If something has fermented a food, it's alive. And so, you're going to get something out of eating that. So I do encourage fermented foods, and have heard from, I gave this talk once and somebody was so glad I said it because she said she'd never heard anybody get better without eating fermented foods. I won't say that that's my experience, but it was, she was kind of an advocate in the field who talked to a bunch of people. So she was just glad that I addressed that issue. If people have gut, yeast issues, garlic, coconut can be helpful, cruciferous vegetables, to support phase 1 detox. Again, people can do what they can do. Everybody has their own situation. They might not be able to have certain foods. Oh boy. Okay, I'm going to just go through this crazy fast. These are some of the nutritional things. Magnesium, huge player, cofactor in, over 300 pathways in the body, has been found helpful for a lot of conditions in the literature. And you just have to figure out what form somebody can tolerate. If they tend towards loose stools, you have to pick, forms that are better absorbed. If they tend to be constipated, you might want to have a little magnesium oxide in there. What did I do? Okay. Omega-3s, helpful for a lot of things, again, in the literature, but I specifically I emphasize it for everybody, but if they've got dry eyes and dry skin, that, is a good time for me to mention it. Vitamin D, we see low levels a lot. It's common in general. It may actually be associated with illness. I think there's a little bit of a chicken or the egg debate on, does the illness cause the low vitamin D or does the low vitamin D cause the illness? But I think everybody agrees that getting it up is helpful. Zinc, also helpful for a number of things. Sorry, I'll go through this quick. B vitamins, huge player. A lot of times you're going to want the methylated forms, the methyl B12 and MTHF. But that's a biggie. That's pretty much everyone. CoQ10, common, found to be helpful with ochratoxin poisoning, with or without melatonin in a rat study. A lot of people have mitochondrial issues, and it's helpful. Other antioxidants, oxidative stress is a big mechanism of illness, and so we've looked at a lot of other antioxidants, vitamins A, C, and E, glutathione, of course, being, they like to call the master antioxidant, but others are helpful. Vitamin C, taken a couple times a day. Probiotics, lots and lots of literature on probiotics, different animals. The one that I want to mention, you've got bacterial probiotics and then Saccharomyces boulardii, which is what they consider a good yeast. It's in the brewer's yeast family, and it's been looked at Clostridium difficile diarrhea and traveler's diarrhea, and it seems to shift the balance a lot of times to healthier. I've even seen it studied for parasite, Blastocystis hominis. They've looked at Saccharomyces boulardii and found it to be effective. Melatonin, here's some of the research on that, has been found to improve some antioxidant markers and injury associated with exposure. Broccoli sprout tree, there's a lot of foods, the lycopenes for aflatoxin, some of the carrot, parsley, broccoli compounds. Resveratrol has also been looked at. Lifestyle choices, exposure, avoiding exposure, organic diet to minimize exposure to pesticides and other toxins. Move. This comes up a lot. A lot of people are so debilitated they are not moving at all, and I do remind them that our venous and lymph systems do not have a pump. So if you are not moving at all, you're working against your body's own ability to detoxify. So whether it be stretching or walking to the mailbox and back, just start to do something. And you want to go below the threshold that triggers post-exertional malaise. And if you can move more, that's even better. If you can sweat with it, that's even better. Sauna, start slowly, gradually increase, and be supervised initially. Especially if people lay in a sauna, they can drop their blood pressure quickly when they stand up. A lot of people do have autonomic dysfunction, and they will drop their blood pressure standing. Epsom salt baths. Get a good product. Apparently, a lot of them, I've been told, are made in China, so you want to source your Epsom salts a little bit. Re-exposure, I do want to talk about this. Common, especially in the first year. You can get your symptoms back. Don't panic. I mean, that's the message I like to give. I've heard something float around that, you reset the clock to 0 every time you reabsorb. That is not what I see at all. If you think that, you're going to just panic every time you have a symptom of exposure. It's just a blip in the rain barrel. You've just, and if you're in better shape, you'll compensate for it better, and it may set you back hard, but you want to figure it out and, solve the problem, but approach it in calm and not in panic, because that, again, just triggers more hypervigilance. And sometimes it is a little thing, a rotten fruit, something happened with a shower curtain, and it can be totally fixed. And the environment is not contaminated. And, the cross-contamination I have not found to be nearly as big an issue as the initial exposure. So because if you were to extrapolate out every level of cross-contamination you could possibly have, you would go bananas, and you'd never let anyone in your house, and you'd never go anywhere. And that's not the way we want to live. So, so you have to be aware of things, but just clinically, although, by cross-contamination, I mean someone brought something in, they brought their shirt from the other house and it's been sitting in the closet with a new shirt. And, you might want to get rid of that initial shirt and, get it out in to minimize, put it in a bag or something, minimize the exposure. But if every time that happens, you now have to move out of your new home, that could be endless. And that, what I'm saying? And that's not what I see clinically. So I just really, again, that first exposure is a biggie, but after that, usually people can manage all right. There are some of the limbic retraining programs for some people have found useful if that not everyone needs that, but sometimes if the kind of hypervigilance is really a major factor. So treatment, avoid, decrease total load. No, one treatment for everybody is going to guarantee it, but together it does improve. Glutathione in different forms, sequestering agents, nasal antifungals and biofilm disruptors, nutritional lifestyle changes, and avoiding re-exposure. Just very quick on genes. I think we know this, but the CDC said it beautifully. Virtually all human illness results from interactions of genetic susceptibility and modifiable environmental factors, infections, disease, physical, nutritional, and emotional factors. So this is it. I mean, we're all products of genes in our environment. And I have a few genomic slides, but I don't need to show them. Are we?
5 more minutes.
Fine, okay, let's go. Okay, so.
Questions?
Yeah, whatever you want to do.
You got 5 minutes.
Okay. Why don't we just look at that, and I'll just comment on this because I think it might be important. Genomics of mold illness are well understood. We can predict based on genotypes who will get sick from mold, and only 28% of the population is affected by exposure to mold. I'll tell you right now, the answer to all of those are false. We have not nailed the genomics of this. I'll probably stop now if you guys want to ask a question or something, but I have more information about the genomics. I'll just tell you, I've been looking at it since I started my practice, and we have little blips. There's a few studies on chemical sensitivity. There's a few SNPs, so I guess I can go through them, that we see, but a lot of people look at methylation. It's important, and but it's not in terms of people with those SNPs, you can get around that by supporting them with the right forms of B vitamins. It's not a dramatic, end of the world situation. In fact, it's extremely common. That's the MTHFR. Oh, these look for certain detox pathways, including medication pathways. HLA affects the way the immune system responds. That's also been looked at in mold exposure and other illnesses. We can test for a lot of things, but we can get more information than we know what to do with. And I think that's true with genomic testing all around. I think people want to think we have all the answers in genes. I prepared for a talk on this once, and we know much less than we, it contributes, it's interesting, it's good information. This does not tell me who's going to be sick or not sick from an exposure or how sick they're going to be. You can do home-based testing or through, and these are a few of the SNPs that have been looked at to some degree in mycotoxins. These are the chemical sensitivity SNPs that have been looked at and found. But again, we don't know, we're getting there. We're getting information, but it's, it's a process. And I don't think it will ever be one gene or, I just don't think it's that simple. We're complex creatures, like the CDC quote said, everything interacts. And yeah, I think we'll just have to keep working with it and paying attention. So, I guess that's it.
We have time for a couple questions. Any questions from the audience? Yes, in the back.
Hey, I'm a naturopath, so I'm particularly interested here.
Okay.
And how do you feel about small intestine bacterial overgrowth
I see that a lot,
and the narrowing of the probiotics that you use to just so few?
Yeah, you get a lot of people with that diagnosis. I think the lucky ones will get an improvement with a course of, rifaximin or something. And then the folks that aren't getting there, I see it, to me it's, I think, kind of a continuation of the gut being off. And so, I know a fair amount about it, but I also know that for the people who don't get kind of an easy, quick fix, it's complicated. The biggest issue I have that I would like to, it would be nice if there were some prebiotics that were accepted for that, because prebiotics, and I don't take credit for this, but I don't remember who I'm quoting, but it was in something I read recently. The probiotics are kind of like the tourists that come and go. They come in, they're there for a few days, they go away, and the prebiotics sort of support the healthier, gut environment. And so, I know with SIBO, they don't want to use most of the prebiotics, but I don't know what that's based on, or if there's a way around that. I'm just not sure. So, because, it's a tough problem for the ones who don't clear right out. I'll give you that. Yeah. Are there things like cabinets and things that can be cleaned and be good enough? There may be. The problem is that there's a lot of unfinished wood in these processes. So, there's a situation where a family was exposed and brought in a single dresser, a single antique dresser that had been completely cleaned. They were doing all right where they were. And when this was brought in, triggered 104.5 fever in the daughter within a day, and mom, night sweats, dizziness, feeling unclear. That was removed. And within the next day, kid was at school, fine, playing soccer, everybody. So I'm hesitant. I share that story because there can be, these drawers are not finished wood, for one thing. So, if you're going to do it exactly like that experiment. Be doing okay and bring one thing in. And if something happens, be aware of it. But, again, I'm not going to say that we don't even know how exposed any one item is. I just know that if I'm a physician, and so I'm erring on the side of health and caution. And I also tell people that I've never seen anybody regret making a clean break. I've seen so many people, and you'll see this from everyone, regret that they brought too much with them. So again, I'm not saying that they have to immediately burn all that, and if they have a little time period where they can put things in store, they don't have to make the big decisions. But in terms of actually bringing it into their living space, I would use great caution with that. Yeah.
Thank you very much.
Thank you.